There's actually some questions coming in the chat. One is specifically actually for Sotorasib for Dr. Luo. So this patient is talking about timing. They've been on Sotorasib for almost a year, 11 months actually, and unfortunately is having progression. But clinical trials are limited, especially for patients with kidney disease. So she or he is just curious about any advocacies or any programs that are getting compassionate access. And this kind of piggybacks on a question that we have in regards to adagrasib, which I know was just presented at ASCO by Dr. Sabari, and also some work that was just published in New England Journal and came about 2 days ago about adagrasib for patients with KRAS G12C. And what are your thoughts about sequencing them, and would this patient be a candidate for that? I'm just curious if you could kind of answer some of that.
Yeah, no, thank you. And I think it really depends, once again, on engaging with your doctor about exactly why someone's kidney function might not be completely normal, because there's a variety of reasons someone might have kidney dysfunction, including simply being dehydrated. And so I think definitely talking to one's doctor about it. I think the other thing is, in terms of these pills, and not just Sotorasib, but also, like when we think about EGFR lung cancer or ALK lung cancer, all of these pill medicines, the dosing can be adjusted or held, and you really, and people still do quite well on lower doses of medicine. And so I think engaging with the doctor about what is the right dose of Sotorasib for me in the context of the other medical conditions I have, whether it be kidney issues or other side effects that you might have, or other concurrent medical conditions. In terms of what other treatment options are available, I think, as I presented in the slide, the good thing about KRAS lung cancer is there's a lot of different treatment options available. And so it might be time to pause that KRAS medicine and try a chemotherapy or an immunotherapy or a combination. It really depends on your form of KRAS G12C lung cancer, whether those strategies are the right strategy for you. And sometimes locally directed treatment, not being on a systemic medicine, is the best choice. So I encourage someone to engage with their doctor about that. The second thing to talk about is this upcoming other G12C medicine called adagrasib. And so this is a similar medicine to Sotorasib, and the data that was presented last month on this medication suggests that it has similar outcomes, and that there were individuals who had slightly more GI-based side effects, but sometimes those side effects are related to the dosing of the medicine. But I think generally the community agrees that these medicines are similar. In terms of whether someone would consider one or the other, I think they're very similar medications, and so I would engage with your medical oncologist once that medicine is FDA approved, which one they would want you to take. And there's actually a variety of other KRAS G12C directed medicines that are being investigated in the clinical trial setting. One thing that was presented at ASCO that I forgot to mention, and Dr. Prishikal mentioned, this was discussed by Dr. Sabari, is that there was some data presented that the adagrasib medication can lead to responses in the brain. So KRAS G12C cancer that's spread to the brain, leading to shrinkage there. So I think it would be good to know what sorts of data is out there for Sotorasib as well. But as new KRAS G12C inhibitors get developed, I think it's good to talk to your doctor about what the next step is right for you. And it might not be a clinical trial quite yet.